I'd like to clear something up regarding the efficacy of the COVID vaccines. I try to communicate to people what I believe to be the truth. A lot of people believe the vaccines are amazing. Others think they're doing nothing and they are dangerous. And then there's a lot of people in between. So I think the only way to get everybody to kind of take a look at somewhat of a objective view is to use the authorities' data themselves. So here I am on the Nova Scotia Health Authority's website. Now I'm using it for basically Nova Scotia. You can go to any place in the world and you're going to get very similar results. The vaccines work the same no matter where you are on the planet. But since I'm doing this mostly for Nova Scotians, I'm going to use the Nova Scotia Health Authority website because that's what they're going to believe. That's what they're going to see as the most reliable authority. So let's go to, when you're on their main, this is their homepage, you go on COVID-19, click on COVID-19, and then you go on all these things down here. Information on the vaccines, testing, information, support people, visitors. I have COVID-19 symptoms, etc., etc. Well, we don't want to deal with that. We want to deal with the data. So if we want to take a look at up-to-date data information, we want to go to this link right here and see what we can find. So there's all kinds of things here. Here's on the vaccine, restrictions and guides, protect yourself and others, blah, blah, blah. What we want is case data, so we'll go to case data. All right, so over on the left on the top here, this is for the 7-day period ending January 30th, and new hospital admissions, 36, positive CPR test, 680, new deaths, 3. New deaths from previous reporting period were 5. So it looks like it's going down. That's nice. And then let's go over here to the right. And then now we're talking about hospitalizations as of January 31st, 2023. And we're dividing it up amongst their vaccine status. So we have 0 dose, 11%, 1 dose, 3%. Now, if we want to take a look at the difference between unvaccinated and vaccinated, well, to be fair, we want to combine 0 and 1 dose together. So 14% of the people in the hospital as of end of January are 14% unvaccinated. The balance are all vaccinated, either 2 doses, 3 doses, or 4 doses. If you add all that up together, it's 86%. So, and you look here, median age is 74. Okay, let's go back on over to the left, and let me just scroll down here a little bit. Now we go, they're going to tell us about the vaccination status of deaths, which is right here, since December 8th, 2021. Okay, so we have, they're calling it Omicron deaths, but I think this includes all deaths. Median age 83, vaccination status of deaths. The unvaccinated here, they combine 0 and 1 dose. So you got 16%. And then the balance, which is the vaccinated, whether it's 2, 3, or 4 doses, is what? I guess it'd be 84%. So already we're seeing, maybe I heard something wrong, but I heard from the authorities on TV, Dr. Strang and Dr. Barrett and Dr. Fauci, Dr. Walensky and Dr. Tam, and I could go on, that if you get vaccinated, you're you're protected. You're not going to get it. You're not going to go in the hospital, and you are not going to die. Only in extremely rare cases are you going to die. Well, this data doesn't really support those arguments, or those statements, I should say, really. Then you go on over here and see, since March 20th, that's the beginning of the pandemic, more or less. And they're not stating this, but I'm pretty sure what they're trying to tell us here in a roundabout way is this is the vaccination status of the Nova Scotians that died since March 20th. And here they don't specify whether it was Delta, Omicron, or the original strain, whatever. So 0 doses, 15%, pretty close to what you have over here. Okay, they break that down here. They combined them here and didn't do it here. I don't know why. So 15 plus 3, that's like 18%. Yeah, it works out, 18 and 82. So 18% are basically unvaccinated and 82% are fully vaccinated. And of those 82%, 54% had 3 or more doses, meaning they got boosted. Total deaths 726. So I don't know, folks. I just now I've read, gosh, hundreds of studies since the beginning of this pandemic, and I knew right from the beginning that what they were telling us on TV was not accurate, and I would communicate that to people, and I said, they're lying to us. And they'd say, no, Tom, they're not lying to us. It's a new virus they didn't know, and that's why they thought it was going to be that and that. And I said, no, they're lying because I knew that the stats they were giving us were not accurate. And I'm not even a doctor. I didn't go to medical school a day in my life. So how is it that I knew and they didn't? That's why I find it hard to believe that they were not lying. So, be that as it may, this is my experience. Just bizarre. As time went on, then I would hear these anecdotal stories from people like even Dr. Fauci on TV. Dr. Fauci is he's like supposed to be like the god of infectious disease or whatever. And anyway, he stated that he got COVID. He got it 3 times. He fully vaccinated, boosted the whole thing. Yeah. And on TV, he said, yeah, let's see if I can mimic his New Jersey accent. Says, yeah, I had COVID, but, fortunately I was vaccinated, so it wasn't so bad. That's anecdotal, Dr. Fauci. That's not science. That's anecdotal. I'm not vaccinated. I'm 72 years old, and for me, I got COVID. It was no big deal at all. I wasn't out for a day. I had to quarantine, but I was out and about on the farm, walking around. I was in the garage doing woodworking, cleaning up and stuff. I had a very slight fever for less than a day, and the only thing I had was I lost my sense of taste and smell for about a week after it was over. So, but my experience is anecdotal. I can't say, I followed a lot of protocols that I learned that you could do, whether you're vaccinated or not, that would dramatically enhance your immune system's ability to fight off a pathogen. But I can't say that one or the other or all those things made it so easy for me. For all I know, I have a great immune system, or perhaps the dose of the viral particles that I got was small. I don't know. And so, and when I hear this from people, well, my brother got COVID and he's 85 and he survived because of the vaccine. Well, maybe, but this data suggests no. And there's even if you're going to accept it, a very large study that was done by Harvard University, and it was they completed it back in 2021 towards, I think it was like summer 2021, And they update it every week, by the way. It's on the web. You can see it. And they included 64 countries, and one is the United States, which they divided up into several thousand counties. High quality study, peer reviewed, and it was published on the NIH website, National Institute of Health, and it showed what they were trying to do with this study is very simple study. They simply took the data from the health authorities in these various locations as to the percentage of the population vaccinated. So in other words, vaccine uptake, and then at the same time, the number of infections. So clearly, you would see a signal. If the vaccines were really working, you would see a signal showing that in areas where the vaccine uptake was higher, you would see disease transmission declining. And yet, the study showed conclusively, and even if you divided it up, even if you went and looked at individual counties or individual countries, there was no signal at all that the vaccines were doing anything. So I'm finding it amazing that this information is not being disseminated on the legacy media, mainstream media in Canada. That'd be CBC, Global News, CTV, and in the United States, CNN, MSNBC, ABC, CBS. They're not telling us. Now, and I've done stuff like this before, where I've asked, enlighten me, show me where I'm wrong. I want the truth. I have no agenda here. God, I would hope that the vaccines are awesome and just saving enormous lives and so on and so forth. But there's nothing to suggest that. And there have been a few studies that do show amazing results. Unfortunately, they've all been debunked by experts you would recognize. You may not recognize them by name, but you'd recognize their affiliation. I'll just mention one, Marty Makary, Dr. Marty Makary. What's so special about Dr. Marty Makary? He's a professor at Johns Hopkins University, and he's been excellent at sifting through these studies. That he's like me. He wants the truth out. He doesn't have any bone to pick. He doesn't have a dog in the fight. He wants the truth out. He's a tenured professor, so he doesn't have to worry about getting fired or anything like that. So he can seek out the truth. So anyway, that's why I'm sharing this. If anybody can enlighten me on this and tell me why I'm wrong about it, I would be more than happy to alter and be excited to know that somehow I've got this wrong. Because nothing more. I would love to believe that these vaccines are awesome, super safe, etc., etc. But so far, I can't find that signal at all anywhere. So, thanks for watching.